Hello, hello, and welcome to another Sunday on Smartnursing. Okay, I hope you can see me. I hope you can hear me. Yeah, let's go this way. Yeah, just looking for a nice spot so we can have a conversation. Okay. Okay. All right. I hope this will do it. Come a bit closer, guys. So, good evening, good afternoon, good morning. Hello, and welcome to another episode of Learning on Smartnursing. I hope you can hear me. I hope you can hear me. Hello, hi. Welcome to Smartnursing. Can you give me a hi if you can hear me? And I would really love to know where you're watching us from. This is Smartnursing, and I'm live from Ghana. And today we just want to go over some medications, some must-know medications that as a nurse or a student nurse you should know. Okay, this is Smart Nursing, a nursing channel where we discuss, nursing, we do nursing tutorials, but then we also discuss issues that pertain to nursing. My name is Nurse Evie, and then this is Smart Nursing. Okay, if you can hear me, kindly say something so I know you can hear me. If you can give me a hi, a hello, a high five, so I can know that you can hear me, then I can go ahead. Can you hear me? If you can let me know where you're watching us from, that would be very glad. Then I can know that you can hear me. Am I audible enough? Let me just check because guys, can you hear me? Is my mic on? Okay, I think it's on. I think it's on, right? You can hear me, right? Okay, I'm just hoping you can hear me. So give this video a like, okay? I'll be very glad if you give us a like, you support us, if you share this link, invite your friends, your colleagues, somebody who need this to come and watch, okay? My background tells you that we are live on the farm. We are usually live from the farm on Sundays, okay? Because we do farm work as well. Usually on Sundays after church, we come to the farm. All right, so as you can see, we are live from the farm today. So let's just zoom straight into our topic for today. All right, there are some medications that as a nurse or a student nurse you need to know. Okay, you just can't do without them. You need to have basic knowledge about these drugs. The first one is analgesics. Okay, the first one is analgesics. Analgesics are the medications that we use to relieve pain. Okay, analgesics or pain relievers. Okay, that is the first thing that you should know as a nurse. All right, we have types. So today I'm just going to give a brief background or a brief overview of what the drugs are, what we should know, and some examples, maybe some nursing responsibilities and some patient teachings that we should give our patients. Okay, later or in our subsequent videos we will take them one after the other and go deep into them. All right. So analgesics, we have the opioids and we have the non-opioids. Okay, we have the opioid analgesics and we have the non-opioids analgesics. Now, example of the opioids are morphines, are fentanyls, are tramadol. So even the opioids have types. Okay, the opioids have types. You can have weak opioids, you can have the strong opioids. Okay, so your petadines are in there, your fentanyls are in there, your morphine, your codeine. Okay, they are opioids. Okay, now you need to know that they have receptors, okay, that they bind with. For example, the opioids have these receptors called the mu receptors, mu receptors, that they bind in our system, and that maximizes their effect, and that brings about the analgesic effect that we know for them. All right, so this is an example of the opioids analgesic that you should know. So for these drugs, they are dangerous drugs, and so in most hospitals, depending on where you find yourself, every hospital has a protocol. Every hospital has yes, a protocol or a procedure, a standard on how to manage these drugs. Okay, so as a nurse, you need to know all these things. So what are some of the nursing responsibilities that you should know when you're handling opioids? First of all, you need to know that even for pain relievers in general, okay, for pain relievers in general, before you administer any pain medication, you need to assess the pain of your patient. You need to assess the level of pain of the patient. Is it severe? Is it moderate? Is it mild? That will inform the type of analgesics you even use. All right, so that is the first thing that you should know. Assess the level of pain. There are so many ways you can do that. You can use the number scale, the faces scale, the flat scale. For kids, you can use them. There are so many pain scales that you can use. Okay, so when you do that, then it will inform the type of what is it called, pain medication that you should use for your patient. All right, so when you choose the opioid, you need to know that this is a dangerous drug, and you need to double check it with your colleague on duty. Make sure you are giving it to the right patient. That reminds me though, anytime you're about to give a medication of what kind, you need to make sure you observe all the rights. Okay, the last time I checked, I think they're about 10. You need to make sure you observe all the rights. Make sure it's the right patient, make sure it's the right drug, make sure it's the right dose, make sure you're giving it at the right time. Okay, make sure you're using the right route. Make sure that the patient understand they have the right to refuse. Okay, so you need to go through all this right, and then be sure that what you're giving is for the patient. Okay, but when it comes to the opioids, because they are dangerous drugs, you need to make sure that you discuss it with your colleague. Make sure your colleague knows that you're giving this drug for this patient. Make sure your colleague sees you give it. Now if you want to waste it also, make sure a colleague sees you waste the drug. Okay, because at the end of the day, you need to account for it. Okay, so let's pay attention to this. Let's stay there for a bit. So I'll quickly just run us through some responsibilities, some nursing responsibilities that you should know, okay, when you're dealing with opioids. All right, like your nursing responsibility. But you also need to know that for analgesics, the opioids and then the non-opioids, they all have some side effects. Okay, so an example of a non-opioid is paracetamol or Tylenol. Okay, wherever you find yourself, or acetaminophen. It's also a mild analgesic. Okay, one of the side effects or adverse effects of Tylenol is hepatotoxicity. Okay, so you need to know that when you take Primo or you take paracetamol or you take Tylenol, you are prone to hepatotoxicity, which means your liver is prone to some toxicity. Okay, that's a side effect that you need to know for paracetamol. Then you also need to know that for the opioids like the morphines, your patients might have constipation. All right, your patient might have constipation. Some vomit immediately after you give them an opioid. So all these things has to be at the back of your mind. Okay, the other side effect of uh, the type of analgesics that we call NSAIDs